Bariatric surgery reduces the size of your stomach, so drinking enough water to stay properly hydrated can be challenging. In this module, we discuss your fluid goals and methods for achieving them. We'll also look at some of the fluids you will want to avoid after surgery and some tips for drinking comfortably.
So one of the challenges that you'll face after surgery is getting enough fluid in. And it's actually, I'd say, priority one when you leave the hospital.
Hydration is the most important nutritional concern that you'll have after bariatric surgery. And the minimal goal is to reach at least 64 ounces of fluid every day.
Initially, the only way you're going to be able to meet this goal is just by keeping something with you at all times. So when you're running errands, when you're at the office, always keep some water around so that you can get that goal in, because you'll find that it's very difficult to meet it initially because your stomach is so small.
If you're not well hydrated, you're going to develop some fatigue. You may notice a drop off in your urine output or your urine flow. You're not having to go to the bathroom as frequently. You may feel a little bit lightheaded or dizzy, particularly when you stand up or get up from a lying position. If you're really having a lot of trouble with that, then we would really recommend that you contact our office. Occasionally we have to bring patients in and give them some IV fluids and check their electrolytes, make sure that those are in balance.
The best fluid source you can put in your body is water. Non-carbonated and sugar-free beverages such as Sobe Zero, Fuse Slender, Skinny Waters, any Vitamin Water Zero, fluids that have no sugar added. You can use regular water and add a little bit of fruit juice to that to make a different flavor. You want to avoid caffeine and use decaffeinated coffee and decaffeinated tea because caffeine has a tendency to dehydrate you. Fluids you put in your protein shakes can count, such as water, whole milk, 2% milk. You can also use sugar-free popsicles and sugar-free gelatin as fluid sources. Most bariatric patients can reach 64 ounces of fluid daily by about 2 weeks after surgery.
Caffeine is a diuretic, and so you want to make sure that you limit it to 16 ounces per day after surgery. If you want to, wake up in the morning, you want to drink a cup of coffee, you need to take in an additional 4 glasses throughout the day to prevent that diuretic effect from the caffeine.
You want to avoid carbonation for at least 3 months after surgery. Carbonation can lead to abdominal bloating, can lead to distension, and it can cause chest pressure. Carbonation is in soda, in some alcohols, and in some flavored waters.
So one of the questions you may have is, after surgery, can I drink alcohol? And certainly we would recommend that you hold off on that for a little while after surgery. In fact, probably it's best to wait until you've gone through your entire dietary evolution and you get to a pretty stable diet where you're eating regular foods and where you're staying hydrated, you're able to take in enough fluids, because one of the things that alcohol can do actually is dehydrate you. So if you're not getting enough water in and you drink alcohol on top of that, it can lead to or contribute to dehydration.
As a duodenal switch patient, you want to avoid any drinks made with refined sugar, such as alcohol, real sweet tea, and regular soda. Refined sugar in a DS patient can lead to extreme gas, distension, and diarrhea. So you need to avoid any fluids made with refined sugar indefinitely.
Let's take a moment to review this module. Sip fluid slowly. Gulping can increase your risk of vomiting. Some people find drinking through a straw creates discomfort. Don't drink while eating. Fluid will reduce the space available for food and may lead to nausea and vomiting. Wait 30 minutes after eating before you start drinking again. Avoid very hot or very cold liquids. Avoid carbonation and limit caffeine and alcohol. Carry water with you all the time and track your fluid intake in your journal. When you are ready to continue, use the menu on the left to select the next module.